Thank you everyone for joining us today. My name is Molly Miller and I'm partner manager with Medcurity. We're glad to have you with us and we're especially excited and privileged to welcome Luke Malek and Kyle Rooks. They are both actively lobbying in Boise on behalf of their clients, and I'll introduce them more fully in just a few moments. Before we get started, just a couple of housekeeping items. Today's webinar is being recorded and we will send a recording out afterwards. We also encourage you to submit questions at any time using the Q&A feature, and we'll be sure to leave time at the end for discussion. You should be able to find the Q&A section, Q&A at the bottom of your screen or through your settings panel. For those of you who may not know us, Medcurity is based in Spokane, Washington, and we're neighbors to several organizations represented on today's call. We work with healthcare organizations in partnership with PCAs like the NWRPCA to support and strengthen HIPAA compliance programs with a particular emphasis on security risk assessments. Our goal is to help organizations approach the SRA with more clarity, less manual burden, and a stronger foundation for ongoing compliance. I am also joined today by our CEO, Joe Galatly, who brings years of experience in the health center space and is currently on his 18th year of service on the board of directors for Chaz Health right here in Spokane. If you'd like to learn more about Medcurity and how we support healthcare organizations after today's session, we'd be happy to connect afterwards. At Medcurity, we believe HIPAA compliance is not just about completing an assessment, but it's also about helping organizations understand the requirements, stay informed on changes, and build stronger programs over time. Education supports that work, and the reason we are glad to host today's webinar. As a lead-in for today's discussion, HHS has proposed significant updates to the HIPAA security rule aimed at strengthening cybersecurity protections for EPHI. While this rule is still proposed and not yet final, the current public agenda points to a target final action in May of 26 coming up right around the corner. This makes an important time for healthcare organizations to pay attention to what may be coming next. One of the biggest potential shifts in these proposed updates is the HIPAA security compliance may become more prescriptive. Historically, parts of the security rule gave organizations a degree of flexibility in how they implemented certain safeguards. In practice, that often meant organizations could interpret requirements differently based on size, systems, and internal processes. Under this proposal, the HHS is signaling a move away from that broad flexibility and towards more specific, clearly defined expectations. What this means in practical terms is a high bar for proving that safeguards are not only considered, but actually in place and operational. It's no longer enough to point to a policy or say a process exists. Organizations may need to show that safeguards are implemented, maintained, tested, and working as intended. That also brings increased expectations around documentation, ongoing testing, and accountability. So really, interpretation is greater specificity in execution from the stated intent to demonstrated compliance. What this means for healthcare organizations is that compliance continues to move away from a once-a-year checkbox exercise towards an ongoing operational program. The proposed update highlights stronger expectations in areas like multi-factor authentication, encryption, vulnerability management, and recurring audits. More broadly, they reflect how policy and regulatory developments can quickly shape what healthcare organizations need to prioritize in practice. At Medcurity, this is why we spend so much time on helping organizations not only to complete their security risk assessment, but also to stay informed, build stronger programs, and prepare for what's changing. With that in mind, I would now like to introduce our guest speakers who will help broaden this conversation by looking at how healthcare policy moves from legislation into real-world impact. First, we're joined by Luke Malek, attorney with Malek & Malek. Luke brings over a decade of experience working with healthcare organizations across the Intermountain West. His firm is licensed across multiple states, including Idaho, Washington, Oregon, and California. In addition to his legal work, Luke is a former 3-term Idaho legislator and currently serves as a healthcare policy lobbyist. His background gives him a valuable perspective on the intersection of healthcare, law, and policy, and on how legislative and regulatory developments impact organizations in practice. We are also joined by Kyle Rooks, Interim CEO of the Idaho Community Health Center Association. Kyle brings over 10 years of experience in government affairs, advocating for organizations that strengthen both community health and the broader economy. Through his work with the ICHCA, he represents community health centers across Idaho, supporting a network of 15 members operating in more than 145 sites. He also played an important role in advocating for funding to expand healthcare access, giving him a strong understanding of how policy decisions affect health centers and the communities they serve. Together, Luke and Kyle bring both policy and operational perspective to today's conversation, and we are grateful to have them here and share their insight. With that, I will turn it over to Luke and Kyle.
Well, Molly, first of all, thank you very much for having both of us here. We're excited to talk about the work that we've been doing and how we can provide sort of a practical guide to healthcare organizations and providers that are worried about a lot of changes that are coming down through various legislators, including the Idaho legislature, which is the one that we spend most of our time working in. So, with that, I'll go ahead and kind of get started and start with on a really kind of higher level, talking about why it's I'll just run through the agenda. So the things that we're going to talk about are the nuance filter. So why a bill's length is a deceptive metric for its impact, right? So you often see bills in the legislature, and you can see a lot of bills in the legislature, hundreds of them. I haven't done a full tally on how many were introduced in the session this year, but there were hundreds of bills, probably close to 500 or 600 bills that were introduced in the Idaho legislature this year. And looking at those, there's long bills that could be hundreds of pages long, and then bills that could just be 1 page long. But although it may seem overwhelming and can be to have a very long bill, it's sometimes the smallest bills that have the deepest changes. So we're going to be talking about that. We're also going to be talking about the power of definitions. So having a deep dive into how the terms that we look at inside a bill really matter, and what resources are out there to make sure that we understand every word that is in statutory language. Because to the average reader, some very important stuff can be missed because there's specific definitions that are attached to certain words. And then just from a practical level, reading in parallel, how to compare new bills against underlying statutes to see the hidden changes that might be existing in a bill. So looking and trying to find out what exactly is changing, both in terms of what we're talking about, in terms of what are there definitions that are changing, and is the plain language, what is going to be the impact of just the plain language changes that are happening as well. And then last but not least, fact versus fiction. How to separate official legislative language from the media or public commentary to find the truth. And we'll talk a little bit about that. But what you hear in the media, unfortunately, is sometimes very inaccurate in terms of what will be ultimately reflected through the legislative process and the laws that are passed. So with that, we can go ahead. Anything you want to add on the agenda there, Kyle?
No, it's great, and we look forward to having this conversation and speaking to the practical experiences we've seen this session as well as many others. So yeah.
Starting with the nuance filter, but the lengthy bills can create public confusion, like we're talking about. So it may or may not be purposeful that a bill is long, and length can make it easy for the true intent of a statute to get buried. And then, like we said, media and the general public and even legislators may become distracted by the less impactful elements of a bill. I can tell you that there's many times myself where I've put a bill on a legislator's desk and I said, how many pages is this? And then I have to sometimes say, well, it's 50 pages long, but really like the only language that's changing is on page 32. So, and so we really hone in on that. But as you can imagine, there are varying levels of trust in the legislative process. So it really is incumbent upon the legislators and those who are involved in the process to make sure that they look at all 50 pages of that bill to make sure that nothing is hidden in it. But like I said, you could have a 50-page bill because it's amending a few words in statute. You have to include the entire existing statute that is there. So you can have a very, very long bill that ultimately is just changing a definition, for example, that has been updated due to a legal terminology or changing best practice within an industry, which we'll talk about a little bit later as we get into this, how subject matter experts, in addition to legal experts, are really important to this whole process, because so many bills impact different industries in ways that are specific to that industry. And so that's where a lot of the definitional stuff that we're talking about can come up, because a definition in one industry could be very, very different than the definition of a word in another industry.
And I'd add to that it's important that as a industry, or in my case as an association, it's important to have a team-based approach with all that. You need the people who can really understand the policy and get into the weeds of those. You need the legal analysis. You need those people, the like lobbyists with the relationships, and then you need advocacy groups. So it's really, I think all of them have to work together as a spoke. And if you were to just have one or the other, it's tough to fulfill what you need to do, because if you don't understand the policy or those nuanced language or those bills, you could be advocating for something you may or may not need or may not care about. But to have that fourfold team really kind of puts organizations in better position to make effective change. So, and a good example of this, where perhaps the media or the general public may not fully understand what is going on behind the scenes on a bill, is last year, it was the most lobbied bill in Idaho, and it's House Bill 345. It had to do with Idaho's Medicaid program, and we were brought in early to work with legislators on this issue. There's elements of this bill that we didn't like, but there's elements that we did, and so we did the best we could to navigate this bill in a way that didn't harm Idaho's healthcare landscape too much. But it's interesting on this bill, the media attention it got versus the reality of the bill. There was just a few lines that spoke to putting in work requirements. Now, we know on a federal side, work requirements through HR 1 were already coming in. So this was relatively duplicative of what was happening on a federal scale, but that was the beginning of the bill, and it spoke to that. But then multiple pages down, it really transforms Idaho's Medicaid system. It moved us from a state-based program that was called the Value Care Organization model, and it moved us to managed care, and changed that program. It changed how directed payments work for hospitals. It got federally qualified health centers out of downside risk in the current arrangement we were in. So, but again, if you were to look at the media on all this, it was only work requirements. And in some cases, there's some media outlets that even reported repealing Medicaid expansion, which that absolutely was not true. And so despite maybe biases or political leanings, we have to really understand what the letter of the law is as we're navigating these.
And I'll just tack onto that. That bill itself was touted as the most comprehensive reform of Medicaid in 20 years. And just reiterating the point that Kyle made, that work requirements, the requirements in that bill were duplicative of Idaho statute that had already been put into place, and that was going to be, that was talked about at the federal level. So it was really, if you've heard the term, the sleeves out of your tank top, right? It's like there was the work requirements side of that was something that had already been implemented, but that became the headline. So, and then tips for dissecting lengthy bills. And this is, I mentioned this earlier, consulting with subject matter experts. This becomes a really important part of this. And then partnering with a proactive attorney who keeps a pulse on legislation. You really do need a team, which is why in the legislative process, you see a lot of associations like the one that Kyle is currently running, the Idaho Community Health Center Association, because it's really hard for one business to be keeping tabs on everything that's happening in the legislature. When 500 bills are introduced in a year, it's hard for legislators to even keep track of all that. Where they're at the process, where they're getting dropped off.
Yeah, and I'd add to that team, and we noticed as an association we expanded our team and got the right people on the bus to help us with our legislative efforts, and not just maybe with one person, but a group of people of different backgrounds. It helped us even like not get distracted or not go down the wrong rabbit trail. Like there's plenty of bills that will come out and will make the headlines. And as an association, I'm getting texts from our members all the time. Hey, this bill, what this is going to be detrimental to us? What's this going to do? But when you have a lobby team and legal team that are in the building as these are getting written and talking to the bill sponsors, you start to recognize this is a political strategy to have everyone look over here when they're really doing something over here. And so keeping the eye on the ball, it's imperative. And one person can't do that alone. Or one, if you're just focused on advocacy, you may be distracted. But if you have the whole encompassing efforts, advocacy, lobbying, policy analysis, then you can really focus on what matters.
And actually, if we can go back to that one for just a second, because I do want to talk about that make this point really, really clear, which is there are industry terms that are, and we'll talk about that in a little bit, but consulting those subject matter experts is why that becomes very important, right? So if we're dealing with an issue that is in regards to hospitals versus federally qualified health centers, do those terms cross over, or rural health centers, however that may be, a term can really have a different meaning, and we'll drive that point home a little bit later in the presentation, but unless you are talking to people who truly know the industry and truly know the regulations around that industry, and I'm not just talking about lawyers, I'm talking about people that are practicing this on a daily basis. We lean on Kyle's team and his membership quite a bit when we're dealing with that, so that we can understand, okay, so when you guys use this term in a clinic, what are you talking about? And they may not always know where that term is originated from. That's where the attorney comes into that situation. But you can know that a term that is used in a hospital setting is different than a rural health center or rural health clinic, or which could be different than a federally qualified health center, which could be different than a private pediatric practice. So really being clear about where that is coming from really relies on subject matter experts. And then, like I said, having an attorney truly run that to ground to say, okay, so they're using it this way. Why are they using it this way in this clinical setting versus that clinical setting? So that you can really start to delve in and say, okay, well, the CFR that is being referred to in the hospital setting is different than the state law that's being referred to in the rural health clinic setting, right? So, but you only know that if you're working with a team that is looking at this from all different angles. So, and we'll get into that a little bit more too. And then the corollary to not taking the size of a bill to mean that it is having big changes. Never underestimate shorter bills as well. Some short, very, very, very short bills, 1 to 2 lines long, can have absolutely devastating impacts. You could eliminate entire sections of code that could eliminate entire programs with just 3 or 4 lines of a proposed bill's language. So really making sure that you're not tying, again, the deceptive idea that the length of a bill is in any way related to the impact that it's going to have.
I think this a good example of a short bill, right? Is so and trying to read everything is it was it was a couple of years ago in one of the Medicaid coverages, legislators were looking at cutting Medicaid, and for those, obviously, I don't know who's on call, but I'm sure it's folks from across the nation. But Idaho definitely has a will to cut Medicaid expansion, so that's something our association is always on the defense for. But one of the lines that you read through this bill was just simply they just exited out dental coverage for Medicaid expansion. If that were to happen, 100 patients would have lost access to critical services. All these clinics would have been forced to rethink revenue based off of a single line through that, and it wasn't necessarily, and it was tucked away in. It wasn't new language. It was just a strike through. So when we as an association are about to do this, right? So there's a lot of work involved with again the lobbying and the different either lobbying or you're advocating or sending in letters, and there's all that. But before we did any of that, we wanted to make sure we got a good solid analysis. So for federally qualified health centers, we have certain protections with our federal grants that we have. So we ran it through our legal team, and in this case for us, it was Malek and Malek, and we said, hey, what does this look like? So before we jump up and down, if this were to go, like what would the end result be, and are we protected? But and obviously, I think we could have we had in our back pocket the different provisions that we could do if this were to become law to protect us and what we could do. But again, that's a lot of work. So then we activated our lobby team to say, okay, let's work through this and share early on how this would impact federally qualified health centers. It's not as easy as folks might think to just strike this line through. There's federal implications, and so we got to work on both those fronts to make sure we had the right messaging, the right legal analysis, and ultimately, obviously, in this case, it hurts us, but everything's built on relationships. And so the relationships we have with legislators, we want to make sure that they're going clear-eyed into these decision makings, whether it hurts us or helps us. That they need to know like what this will do on the end run for them. So we just provided that education. And they, they're in Idaho, they don't have staff. They're working on their own. Their backgrounds, majority, I don't think, maybe a handful are attorneys, but to have that resource as a trusted partner that some attorneys looked at this, and so they could do what they want, but at least they have that information. Many, after coming in good faith, will listen and make amendments as needed. So,
and to be clear, Kyle, you were talking about legislators not having staff, right? Like this Idaho legislature, which is different than other legislators. That's
correct. Yep. The Idaho legislator, and I know other states are different, but Idaho legislators part-time do not have staff members. They're figuring this out all on their own. So they rely on industry and associations and lobbyists that they trust to make decisions.
And I'll make it clear there too about the fact that the role that Kyle plays with his association is really one truly built on trust because of that, right? So if he goes and is deceptive in any way about the types of issues that we're talking about here, if he knows that there's a definition that means one thing and he's not forthright with legislators, that could be a move that would severely impact his career, because there's so much trust that's built and has to be worked through on in the legislative process, and so if you could put yourself in the scenarios that we're talking about here, Kyle is going and representing that this bill says one thing to the best of his knowledge, and going to legislator after legislator and saying this means this, this means this, this means this, and this is what the impact of that bill is, and he really taking the long view of that and being honest about things that may not be the most flattering to the position that he has to represent and that others have to represent.
Just to close out our example, it happened a few years ago with the dental cuts. So dental was preserved, and again, it was because once they realized the struggle that would be on a federal side and the different laws and rules. And again, we obviously, our positions do not cut dental. That is imperative to our services, but highlighting that in a factual manner to these legislators led to them not pursuing that. So. Yeah, so when we're talking about conflicting definitions, one of the areas we have seen this in was, and especially, again, I'm going to go back to obviously my experience representing the federally qualified health centers in Idaho, is many, many, many times there would be bills aimed at hospital systems, and legislators didn't have an intention to necessarily put this on their small local federally qualified health center. However, through definitions and just a lack of understanding, there's been so many bills that we'd have to read through hospitals that they, through the bill language themselves, would classify federally qualified health center as a hospital. And again, we'd call our our attorney team, and we'd reach out to them and say, okay, we know that we're not a hospital, but is there anything in here that gives that validity? And then they look into it and say no. And so we'd have to go in and correct, and we don't want messy laws, right? So even if hypothetically they pass something against the hospitals and truly we aren't classified as that, it just complicates it in the law if that's not clear from the start when they're writing these bills. And if federally qualified health center in Bill A is classified as a hospital, but the rest of the statute, that is not the case, then it just creates a messy system that we'd have to work through later. So, yeah, I mean, in healthcare especially, I mean, there's so many definitions, and working with legislators that don't understand the healthcare system, and just because that's not their industry, right? It's not, no knock on them. That's just not what they do. They're trying to take the best information they have and work through making legislation. We have to be very, very, very proactive in the smallest definitions and the language. And again, I'm just, as our association in Idaho, we could not do that by ourselves. Absolutely not. We have to rely on a team. And again, in our team, that is the Malek team, to help us decode those.
We're working from the same room here, so you can probably see us toggling off and on mute. But if we, Connor, do you mind going back one slide real quick? Perfect. Yeah. So with the Idaho legislature in particular, there's a lot of strong feelings about healthcare issues, and I know that is not something that is unique to Idaho. And so you get legislators that have personal experiences, and they get an idea in their head about something that must change. And this is just reiterating the point that Kyle was just making, which is that you got to be careful about those definitions, because those ideas can have unintended consequences even by the authors, right? Because they are working off a definition that they have in their mind of something that happened specifically to them or to one of their family members or one of their constituents. And so helping educate that, again, and I'll reiterate the point again, the credibility of the people that are working with the legislature becomes very, very important, because Kyle can then sit down and say, I understand what you're trying to do here, but here's the impact that you're not seeing in the definitions that you're coming up with. So I just wanted to go back and make that one quick point there. So thank you, Connor. We can go forward now.
Another example, and brought up the hospital example, and that'll come up here in another slide. But similarly, so one of the issues that has been a ever-present issue, and for those hospital and FQHC friends that are on the call right now know this issue all too well, but basically is around 340B. And this is a program that it's at the federal level, and it's one that provides reimbursement through working through drug manufacturers and PBMs to provide reimbursement for covered entities. And so that's the point of this slide, is not to necessarily talk about the 340B program, because we would be here all day. But one of the examples that we've seen over the years in this is the definition of covered entities. So I think the general public, or legislators even, or anyone who's not deep in the weeds on 340B policy, which it's a whole different animal in and of itself. Covered entity, if you're running a private practice, you could think, oh, this applies to me. What do I need to do? Or if you're running a standalone dental clinic that, just out of, just by yourself, that you could think that's them. But no, covered entity truly is a federal definition that is, and it's listed out on a group of organizations that qualify. And it's a little bit of an extensive list, but the majority of it would be hospitals, and those would be, and even in that definition, not all hospitals are covered entities. That's really kind of segmented out within federal statute. Federally qualified health centers, Ryan White clinics, disproportionate share hospitals, and so this slide is just primarily an example of when we're doing 340B legislation, it will say covered entities, but to truly understand if you're a covered entity or not, you'd have to go into the federal code that's being cited, and then they would get the list of definitions. And then just to wrap, I jumped at the gun a little bit, but again, to reiterate that point, that's one issue we have seen a lot is, the difference between the hospital definition and the FQHC definition, providers. But, and then what would happen to us before, again, this is in a few years ago before we were able to really make it a strong team that would go and represent us at the Idaho State Legislator. Many legislators had no clue what a federally qualified health center was. And so in their mind, they're just thinking, okay, yeah, it's a clinic, I think. I think it's, they get government funding, not quite sure. But let's just call them a hospital. And so that would happen to us all the time. But then over the years, and as our team has expanded and we've worked with the right folks, I would dare say that most Idaho legislators have a comprehension of who we are and how we're different, and we're not a hospital, we're not a standalone clinic. And while the FQHC definition is somewhat extensive and nuanced, I think legislators who are healthcare is not their main industry are understanding the difference between us and our other peers in the medical industry. And again, that goes back to, so as we're looking at definitions, sometimes the definition is getting out in front early and just really clarifying early on what's going on. So before they're drafting bills, that way you're not playing catch up. But if legislators can understand your specific industry early on, it can be clarified early on, and you're not trying to run behind the scenes and fix it.
So reading in parallel again, this really becomes where, as you can see in point 4 there, considering reviewing this with a lawyer, and if you have an association that represents you, making sure that their legal counsel has a look at this as well. So a lot of times, if you have never looked at a piece of legislation before, there's a lot of words, and it can be really confusing for someone that has never looked at a piece of legislation before. And so you're going to look at and every state has a different way that they present legislation. At the end of the day, it's all meant really, except in a few instances, if we're looking at a bill, it's language that is meant to change what the statutory construction of a state is, right? And so you have to look at all of the words in every single piece of legislation, because what you're reading can change based on sort of the preamble. So not every word that is in a bill obviously is going to end up in statute, because there's going to be something identifying the bill and identifying where in statute it's going to be changing, and indicating whether it's going to be new language or whether it's going to be eliminating language or that exists, or amending language that may already exist, right? So it's really tempting to just try and jump to the piece of language that you think is going to be impactful to your business or to your industry. But you have to read all of that in context and say, okay, so this is a new piece of language. So this is either replacing or changing or somehow adding to the statutory code, or like I said, it could be amending the current language. So, but you won't know that unless you start at the very, very top of the bill. And the way that a bill can be written, it can amend certain language, or it can, in one area of code, it can add language in another area of code, and so on and so forth. So you have to make sure that you take the full impact of that legislation into account. So that's where you end up with the 100-page bills that don't really do anything, right? So if the definition of provider changes somewhere in statute, and then they have to go back and say, okay, so now we have to change the word provider to say caregiver in this whole statute, and it's listed 75 times. It's not really changing anything. It just means that the code has to be updated throughout. So they end up with a 100-page bill, like we were talking about earlier. So but there is no shortcut to getting to true understanding of a bill. And even with ChatGPT, even with Claude, which Kyle loves, you have to make sure that you're putting eyes on exactly what is going to be changing, because there are no shortcuts to making sure that something that impacts your business, something that impacts your industry, is done correctly. And I'm pretty old fashioned, because I think there's a difference between reading something on a screen and reading something on a piece of paper. I will read it on the screen for sure, but then I will print it out and see what tricks my eyes played on me with a piece of paper, and lay sheet for sheet, line by line, saying, okay, is this good? Same thing that you would imagine your lawyer would do if you were involved in contract negotiations, right? Did opposing counsel try to sneak something past you? We do the same when it comes to legislative language as well. Many times, running back to the office, printing something out as we first get it, and going line by line through it and saying, okay, here's a change. Why did they change that? What does this mean? Really trying to get down to the bottom of that. So printing it out, as the number one says, and putting them side by side is really, really, I think, important. Again, I read a lot on my computer. I read a lot on my phone. I probably read the most on my phone, because you're running around the Capitol during legislative session. But when it comes to these really nuanced changes, making sure that you're doing things right, you've got to make sure that you're looking at things in their full capacity. Like I said, AI can be really great for a quick analysis, and I do that too. Somebody will send me a PDF of a bill, and it'll be a different version than something I've seen before. So I'll ask ChatGPT to do a quick analysis and flag things for me on the fly, because I don't have time to run back to the office and print it off and do a side by side. And then reading every word carefully, like I said, I mean, that's I just can't reiterate that enough. Making sure that you have the subject matter experts, the legal expertise, to make sure that you know exactly what's changing. Anything you want to add on that?
Yeah, and again, I mean, it's another emphasis on finding the right people in the room. And so for us as an association, we make sure we have a committee that has the right folks, whether it's doctors or dentists, and how would that work practically, right? So you can't, obviously we need the policy and analysts, and we need the lawyers, and we need to understand the language and the words. But then having those people who this will impact at the end of the road, helping us as we analyze bills and what our positioning and how we need to handle it, is incredibly valuable. Again, going back to 340B, there's so many pharmacy bills over the years that we've done, but I have a group of pharmacists on speed dial, and I'll be like, okay, at the end of the day, if this happens, what does this look like for you practically? And that helps shape the narrative too when you're talking through a legislator. What does this do at the end? What is the implication? How will this help or hurt the people who have to abide by these laws at the very end of the day?
Uh, I'll dive into this one real quick. So this is a statute that came out right at the end of session, and it obviously one of the issues that we follow really closely in the state of Idaho. For those of you who aren't from Idaho, and I know there's quite a few of you on here, one of the issues that our state is facing is a serious lack of providers. We rank 49th in the nation for providers per capita, and so it's a really hot topic, understanding undergraduate medical education. So when we, right at the end of session, saw that there was a bill dealing with undergraduate medical education, we jumped all over it, and that was House Bill 1420. Wondering what sort of activity is going to be happening here, and is it going to help us, or is it going to hurt our ability to retain doctors and get people into our pipeline for medical education? Luckily, it was a really good bill, and even the sponsors didn't think it had a chance of passing, but it did, and it ended up being a funding bill. The language that you're seeing here is just a snippet but it's a 2-page bill, again, a small bill, but it creates a fund for the first time that will be funded by, you can see the state tax on health insurance premiums. And that will go to help fund medical education in the state of Idaho, which we've never had a funding stream that has been dedicated like this before. So a very, very small change. You can see all the, as you're looking at this and as you're looking at Idaho bills, lines through language means that the language is going away. Lines under language, the underlined language is going to be added to Idaho statute. So you can see all the changes that this entire bill did. But this is one of the ones where we were able to look really carefully, put it in context, and then say, okay, this is a good thing for Kyle's association.
So it's, again, there's so much, it's such a different world, when in the building at the Capitol and when bills are being drafted than what ultimately makes the news. And that's why it's so important for industry, especially the healthcare industry, to have folks that are there and having these conversations in real time. Because by the time it makes the news, it's virtually too late one way or the other. Either it's dead in some ways or it's happening. And so to try to catch these issues early on is the only way to have success for organizations. So, and it's, we all know this, but it's important to recognize, the news and the various advocacy groups have their own motives. Ultimately, and if you don't have an association or if you don't have a lobbyist or somebody representing your industry, the best way to figure out what's going on when a bill pops up or surfaces is call your local representatives. And they can share what their intent is, what they're thinking. And oftentimes that is a great education tool. Like, hey, I know you're thinking it maybe on the defensive side. I know you're thinking this bill would do X, Y, and Z, but it actually does this. And it allows them to hear in real time. And I think legislators are so much more receptive to that one-on-one call, at least in Idaho, that one-on-one call that from their local constituent of, hey, this bill's going to hamper my ability to do X, Y, and Z. Can we rethink this? And then that gets them thinking, okay, how can we change this, or how can we make amendments, or do I just drop this bill? So, and then it just, that human-to-human element, it's easy to, if you're just looking at the media, it's easy to look at the politics or to assume ill intent. But once that conversation happens with the legislator and trying to understand what their end goal is on different legislation, that helps. And of course, keeps them accountable, that people are watching. They can't just pass bills without their communities recognizing what's going to happen and doing that. And then the biggest one is, and we have this strategy in Idaho, is like, it's so important not to write anybody off, no matter what the news or media or different advocacy groups will say. They're people at the end of the day. They're elected by their constituents. They're trying to make whatever they feel is their best decision for their communities. And so going to every single person, despite whatever political stripe they may be, and having those conversations has real impact. And again, back to our previous conversation earlier, builds that trust. Without trust, none of this policy can't be shaped. And so that's been our method and our motto as we work throughout the Capitol.
One thing I'll tag on that, and I couldn't agree with what Kyle said more. I mean, that's the philosophy that we both take into the Capitol is a philosophy of respect. Another lobbyist that we worked with said the voters are never wrong in our system. So treating every legislator that's there because of the voters with the dignity that they deserve because the voters put them in there is respect to our entire system and to the voters. And so that is one thing when we talk to members of an association like Kyle's, and Kyle's association is tremendous at this, but others as well, and all clients. As you go to talk to a legislator, sometimes you can get really emotional about the impact that they're having on an industry. They may not always understand that, but the worst thing that you can possibly do is attack that person. So being really, really calm, collected, understanding of what, like Kyle said, these are people who are trying to do the right thing by the people that have sent them to the legislature, and eliminating the noise of the media, maybe putting some of your own biases aside, and coming at this from a respectful but not condescending perspective either, and just saying, I would really like you to hear my perspective. It's a huge part of that, and then being well armed with the facts, which is the whole point of this presentation, right? And these are lessons that go not just for Idaho, but for every single state and every single political process that we deal with, whether it's legislatures, whether it's the agencies that you deal with, that impact your industries in the states that you're in. That respect and trust. Nothing happens without them. Nothing good happens without them, I should say. So I just wanted to tag that onto what Kyle was saying there. And we do want to reserve some time for questions. I think we're just about done with our slides. Yeah. So moving on to questions. We're excited to hear what you guys would like us to answer.
While we wait for those questions, I just want to thank you both, Luke and Kyle, for joining today. What a wealth of information. It's you guys do just the bill portion of what you're doing with community health centers is such a huge portion for things to change in the community, and for that narrow focus of FQHCs, but to be able to see what a huge impact that it has on the communities. And I'm sure our Idaho attendees are sleeping better at night knowing that they have both of you working so hard to have the advocacy that you guys are doing.
Oh, thank you. And thanks to everyone at Medcurity for inviting us to this. Appreciate it. I did see a question pop up. What's the name of the association I represent? And that's the Idaho Community Health Center Association. And our industry has a lot of names and acronyms, but it's basically representing Idaho's 15 federally qualified health centers.
And I just want to tag on what Kyle said too. Thank you to Medcurity, Molly. Thank you to your team for putting this together, and to Full Swing PR who helped with this as well. And the special shout out to Health West at Pocatello, because they're hosting Kyle and I today as we're traveling to go see some of his members. So that's why we're in the same room, because we're traveling across the state, and they were nice enough to put us up to make this happen today. So, but Molly, really grateful for the opportunity.
We are very privileged to have you on with us today. So thank you guys, and thank you to your partner to make sure that this happened today.
And we did get another question here. What is the best way to educate our legislators on our specific issues in a short period of time, especially as FQHCs?
That's a really, really good question. And it takes investment on the front end. So in the off session, that's where the broad education has to happen. If you're waiting to talk to a legislator when a bill that comes up that you either support or against, you kind of missed it. So early investment in those relationships is key. Legislators have to make all these decisions really fast with limited information, so if they can, again, going back to trust you on stuff, especially as it's complicated, that's important. But to the practical standpoint, if an issue comes up, having that team kind of get together and put together one-pagers, really just concise, factual information that won't overwhelm them, overwhelm the legislators, that is key. And so, again, though, I mean, we've dealt with so many complicated issues over the years, but that basic understanding of who our organization is and the clinics that are in these legislators' community helps so much when it comes to that complicated issue. Because then we had a really complicated issue towards the end of the session that dealt with how we do a change in scope process. I won't bore you with those details for those who aren't FQHCs, but it passed unanimously in both chambers and passed into law just because of the trust. They're like, okay, we trust our community health centers, and they're saying they need this, and the department's saying this is good, and everyone's on board. Like, let's just pass this thing. So that's been one example that we've had on that. So I think I see another question too.
Well, there was just a very nice chat message saying thank you very much, you two. Another thank you. So I'm going to take this opportunity to share this next slide, which is just if you have a question that you don't want to ask live here, we invite you to reach out to contact@malekattorneys.com if you have any further thoughts or questions that you want to share. We'll also be sharing the recording, as Molly said at the beginning. So if there's anything you want to revisit or share with your broader team, of course, feel free to do that too. Molly, anything else that you want to share as we start wrapping up, unless there's any more questions?
Yeah, any more questions, please roll them in. I want to thank everybody in attendance today. I know time is extremely valuable, and we appreciate you being present and being able to be a part of our discussion. So thank you, and thank you to Luke and Kyle again, and Kana for helping get this going. Really appreciate it. Hopefully we've got another one coming up down the road.